Yes, hello everyone. Welcome to our channel today, and it's Emmanuel here. Today we want to dive in a very critical topic today about hypertension. So briefly, hypertension is when your blood pressures are consistently very high. But I'm here making a video today because you find in most settings where we come from, it is being misdiagnosed. So for hypertension to be diagnosed, it has to be taken consistently and it must be high. Yeah, and in the real settings, you find taking it demands a lot of critical thinking, and you should have a very good blood pressure monitoring machine. And in the advanced setting, people use the ambulatory blood pressure machines. So taking the first reading, the first blood pressure reading, it has to be consistent for the first time, at least 2 weeks apart, and it has to be the resting blood pressure. Your patient must have rested. So I want to contribute also to why the blood pressures are really taken wrongly, like they're being misdiagnosed. One can be the process. In the process of taking the blood pressure, you might find the machine could be faulty. Like the cuff may not be working so well. That one contributes to one of them. Secondly is your preparation of your patient. It is what they call the white coat syndrome, whereby the patient can become anxious about the patient, the doctor, because he can get scared and fears everything around you. Then the blood pressure could also suit up. Then in the most communities where we come from, you find people are put on drugs without any indications. First of all, in the management of blood pressure, the first step management is the lifestyle modification. When you find a patient has a high blood pressure, you don't put the patient straight away on drugs. You need to do some baseline interventions. First of all, one is the lifestyle modification. You advise your patient to change the diets, maybe restrict salt intakes and also eating too much fatty food contents. Then thirdly is regular body exercises. When this fails, that's when you go to the option of the medicine therapy, using drugs, whereby you give those beta blockers and the angiotensin 2 converting enzyme inhibitors. Those ones you opt for. That's the second option actually. You don't start the patient on drugs straight away. So you find in most settings, the patient comes, you take the blood pressure without knowing where he or she comes from. Maybe he's scared of you, the doctor, but you put him on drugs straight away, which is really a very bad practice. So you need to have a very consistently high blood pressure for you to start being taken on drugs. So I would like to speak back to the patients. You need to be very careful about your health by also tasking the doctor to explain to you why your blood pressure is high and what are the contributing factors, because these things have complications. One of them is a heart disease. You can develop stroke if the complications are so severe. So you need to ask your doctor why he or she is putting you on drugs. Are there other means to avoid taking the drugs? One of them is the regular body exercise and lifestyle modification, avoiding taking alcohol and also smoking. Those are the first principles which you need to follow before you are being put on drugs. So that's what you should do as a patient, because most of the doctors may not care so much. They may want to just put you on drugs, but it is very advantageous that you take an action and you task the doctor to explain to you what blood pressure is. So thanks for watching, and we'll meet in the next video.